We operate 120 clubs. They're open in development in 12 different states. So we actually have tremendous data as far as check-ins. We have almost 400,000 members within there. And what I would say is that health clubs really are an extension of healthcare. And this has been the case for a long time. If you look at the country, we are 71.6% of the country is overweight or obese. And we know that being overweight or obese is a leading indicator to pre-existing conditions. And if we want to keep people on ventilators and we want to keep them out of the hospitals, we actually have to help people get healthy. So that has been a big focus of ours. We actually are very honored and humbled to have good relationship with a number of state governments. Matter of fact, just this morning alone, with the announcements out of New York, I was on the phone with teams from the governor's office in New Jersey earlier this morning. I spoke with Florida, as well as just a little while ago, I hung up from the governor's office in New York. So we weren't caught off guard because of the partnership that we have with them. We were a little disappointed with the earlier closure. And one of the things that we shared while we have, and this is probably what we should have started with, we are in the health business. So we have tremendous respect for the seriousness of the virus. It is very real. But we do think that while being fit and healthy will not prevent you from getting the virus, if in fact you were unfortunately to get that, if you were fit and healthy, they'd probably send you home. So we think that we are not part of the problem. We think that the industry can actually be part of the solution. And what we shared with the governor's office a little while ago was, again, we will follow any mandate. We're all in on the health and safety. But closing early at 10 p.m., the only people that work out at our clubs between 10 p.m. and 5 a.m. are policemen, firemen, and healthcare workers. They're shift workers. So it's just a consideration, that we ask of the state, as well as Governor Cuomo. And by the way, I have every confidence that the governor wants every New Yorker to live their healthiest life. And these are not mandates to make people feel uncomfortable or, pull back, stay home. But we do ask that we get separated from restaurants and bars. And I'm originally from the restaurant industry, so I have a ton of respect. But the reality of it is, as much as I love going to a restaurant or a bar, they're not essential. I do believe that being healthy, especially in a pandemic, especially where we are today, being healthy is really essential. And at the same time, Chicago, came across, and we just got that notification, was the same exact time that we heard from a number of doctors that are asking for health clubs and gyms to actually fall into that essential category, which many people may not remember. The federal government originally back in April put health clubs as essential businesses. Interesting.
Andrew, let me ask you, and I think you make a good point about who's using your facilities overnight and those workers you want access to. I think there's also a timing mismatch. Obviously, we want people to be in shape, but that takes a while, and COVID is happening now, and they're, with gyms, with the way that people sweat and interact, it's obvious why there's a concern there. What's the financial impact from Chicago's move? Again, it's an advisory, but what kind of financial impact are we talking about if other cities go the same way here? And how much help have you gotten on the PPP front or whatever's available?
Yeah, well, thank you. You know better than anybody, PPP really didn't help. PPP helped the unemployment system. It really did not help business owners. And unfortunately, while many industries have received relief, I've been fighting, and beyond myself with other industry leaders in fitness, have been fighting very hard for the small business owner, which many of those are small business owners in the health and fitness industry. Matter of fact, Retro Fitness is a 100% franchised organization. So every one of our franchises is in fact a small business owner. And that's really where a lot of my relationship was developed with the states. And they are trying very hard. But the reality of it is that our small business owners who live in the communities that they are working in, which is really important, they are not Amazon, they are not Google, they are not these big companies that are benefiting during these times. These are folks that are, while they've gotten deferrals, are 4 months, 6 months or greater with rents. So as we've opened back up, Vendors are knocking on the door, landlords are knocking on the door, they're running their businesses, but we have not gotten the relief that we've needed. And across the country, Chicago or otherwise, 6,000 plus health clubs during a time when health clubs are probably more needed than ever, have shuttered their doors, and most of them will not be coming back.
Shepard Smith here. Thanks for watching CNBC on YouTube.